Hi everyone, let us talk about the status of pulpal inflammation or the pulpitis in a young permanent tooth with a deep caries lesion. A young permanent tooth is the one which is newly erupted in the oral cavity and still the apex of the root is not yet closed or it is in the process of closure. Considering a clinical situation where the child reports to your dental operatory with a young permanent tooth having a deep caries lesion, and we begin to ask about the history of pain. Now, when the child says that there is no pain or there is an elicited response or provoked response, that is, when the stimulus is there, the pain is there. When the stimulus is removed, the pain subsides. In such a condition, the chances are the status of pulp is reversible. If there is, the child says that the pain is there and it is spontaneous pain, then the chances are it is a condition of irreversible pulpitis. Now we begin to test the vitality of the pulp, and preferably we will use the cold test. And if in the cold test there is an immediate response to the cold test, this suggests that the pulp is still vital, the condition is a reversible pulpitis, and we can plan out for the indirect pulp therapy, direct pulp therapy, cervical pulpotomy, partial pulpotomy. So we can just preserve the vitality of the pulp by these type of treatments. Suppose there is a lingering response with the cold test or delayed response, or there is a no response, then the chances are the status of the pulp is irreversible pulpitis, and in such cases we may need to proceed with pulpectomy or the extraction or the apexification or the pulp regenerative procedures. So in that case we now do the clinical evaluation, and when we see if there is still the presence of sinus tract and or swelling is there or the tooth mobility is there, then the chances are it is a condition of irreversible pulpitis. If all these three things or four things are absent, that is, there is no sinus tract, no swelling or no mobility, then the chances are it is a reversible pulpitis. However, if along with this we take a radiograph and we find out that there is pathological or the periapical radiolucency is there, in such cases the chances are it is a condition of irreversible pulpitis, and we will proceed with pulpectomy, epexification, or even the extraction. So these are the things that we